Hello, Lolly. Right, this is for you to do every day because you said about your bum and your hips and your thighs, madam.
Every other day. Right. Step forward. So feet hip width apart, tummy's touching nice and tight.
Talk quite loud if you want. When you stand near it and shout, then she'll hear you.
So, feet hip width apart, tummy touching super tight, weight through the heel of that front foot. So pull the toes up in the shoe and you're going to drop vertically down towards the ground, making sure that that right knee doesn't come too far forwards, and you can always see the toes of your front foot. So you always can see the toes as you drop down through towards the floor. And we're going to do 15 of these.
8.
This is 8 now. 9, 10, 5 to go. You're going to breathe in on the way down and out on the way up. Nice big breaths. Make sure those muscles get lots of oxygen.
Last one?
Yeah. Switch legs. So again, weight through the heel of the left foot this time. Keep the feet parallel, so toes face forwards. And drop vertically down, not letting the weight go forward into the toes. Head and chest are lifted. Breathing in on the way down and out on the way up. This is 10. And last one coming up. And quick shake, quick rest.
This is a short beginner's one, Lauren, because I'm knackered.
Yeah. And then what we're going to do is we'll progress you in 4 weeks' time. We'll do it the next level up and send another video.
Same again, or what?
Yeah. Let's go one more round just to make sure I've given all the teaching points. So, big step forward, weight through the heel in that right foot. Tummy's tucked in nice and tight, pull the pelvic floor muscles up as well. Shoulders back and down, head and chest stay lifted, and we drop vertically down towards the floor.
How far down should you go?
As low as you can.
That you can get up again after?
Yeah, as long as you don't rest the knee on the ground, it can touch the ground if you want. 5 more. Really drive up through that right heel. 2 more. Last one. And change legs.
Smell like dinner?
No. What does it smell of? Oh yeah, I can. Oh, I just got a big waft of pie or something. Steak pie. That's 8.
It's 9.
9 now. 10. 5 more. And last one. And rest. So quick shake. Now we're going to go into squats. So we're going to stand with our feet hip width apart, toes facing forward, so the feet are parallel. And we're going to have the weight in the heel, so again you want to be pulling the toes up inside the shoe, and you're going to push the bum back but keep the head and chest lifted, and you're not going to go down lower than 90 degrees, but just go as low as you can without letting those knees come too far forward. So Debbie can actually go quite low, but you don't need to go as low as that, as long as you keep the weight through the heels. That's the most important thing, and the bum goes back and the knees don't come too far forward. So it's like you're sitting on the toilet basically. As you come up, you're going to squeeze up through those heels And you're going to push the hips through, but make sure you keep some softness in the knees. So never ever lock the knees out on these or on any exercise. 3 more. Really push those hips through, squeeze the glutes as you push the hips through. Drive up through the heels one last time, and quick rest. So we're going to go for our second set.
There's a second set.
There's always a second set. You're lucky there's not a third set today. I'm feeling generous. So, back to our second set of squats.
Don't even think about not doing it, Lauren.
Squats, squats, squats. I promise she's not been drinking.
We not work.
She's tired. Okay, bum goes back. So just watch those knees, don't come too far forward. Really think about pushing the bum back. Hinge at the knees, push the bum back, weight through the heels, pull the toes up in the shoe. Always pull the pelvic floor muscles up and make sure that tummy's nice and tight on every exercise that you do. This is 10 down, you've got 5 more. So really squeeze those glutes as you push the hips through. 4 more.
Wobbling.
3, 2, and last one. And quick shake and rest, and I'm going to go and get the broom.
Shake and rest as opposed to shake and back.
So we're going to use this just for balance. We're going to do side leg raises.
What
So,
is this helping with?
this is doing your glute med, which is this big muscle that comes around the arse and around the outer thigh area. So, the outside leg comes up off the floor, feet stay facing forward, and you're going to drive that leg out, standing nice and tall, so the tummy's still touching nice and tight. Keep the toe facing 12 o'clock.
Just check it's recording with the little red lights flashing.
Yeah. And if there's a tendency for the toe to come out, so as Debbie gets tired, you'll see that her toe comes up a little bit. Just push the toe down. So push the toe down towards the ground, but keep the foot flexed. So you're almost trying to point to the other foot. I don't know how many you've done.
13.
But you're breathing out on the way up and in on the way down. So really big squeezes and switch legs. And these ones creep up on you as well. So this is good for the old saddlebags. So we're 10 down, keep pointing that toe down and flexing that foot. Tum is tight. Look how happy she is to be doing it. And last one, and change legs. You might have done a bonus one there. And that's a good way, that's the best way to stretch out the glutes. You're pushing that left knee down towards the floor and sitting in a low squat through that right leg.
It's as important to stretch, isn't it, as to do the contractions?
Yeah, otherwise you get big chunky muscles, and we want nice long lean muscles. And it reduces the risk of stiffness. Although after your first couple of goes you will still get stiff.
You will feel like someone has hit you with a bat.
True.
That's normal.
Yeah. Okay, last set.
Oh. It's really wobbling there.
Yeah. So by now you're probably getting a bit of shakes and stuff through those thighs, but the shakes are a good sign. So you just have to keep on pressing through. Now on your first couple of goes you might just want to do 12 reps and not the 15. Because Deb is a pro
14.
and 15 is still challenging even when you... No. 15 is still challenging even when you've been doing it a while. if you've got the technique right.
Especially when the standing leg's tired.
Yeah.
Hard your back.
So flex that foot, really pull the toes up, good. Five more. Shaky left leg. Last couple. And rest. So just show us that stretch again. Stretch out through your glutes. So cross over. So ankle over knee, sit down nice and low. And kind of with your elbow, you're pressing that left knee towards the ground. And you want to hold each stretch for a minimum of 15 seconds. So 15 to 20 seconds.
This is where it really hurts, but push through the hurt, because that's why you don't get stiff so much.
Yeah, it's not comfortable stretching. You have to take nice, long, slow, deep breaths. In through the nose, out through the mouth. Okay. And stretching through the quads. So you can use the broom for balance. So take one foot up, keep the knees together. So try and get that left knee towards the right knee a bit more. Hips come through, push the laces of the shoe into that left hand and that really pull up the hand against the foot and then push those hips right through. So nice stretch all the way down the front of that left thigh. And change legs.
It really is making it longer and leaner, isn't it? Not rather than...
Yeah, stretches it out nicely. And you can see your mum's got some funky new trainers for the occasion. Especially for today.
They're currently white.
Just hold that for another few seconds. And stretch out the hamstrings. So just be careful not to lock that left knee, so keep a little bit of softness. And you're shooting the bum back and you're getting a nice stretch at the back of that left upper thigh. So from just below the glutes through the knee. Sometimes the calf will come into it too, depending on how tight the calf is.
Very.
Calf's very tight. And switch legs. Again, make sure there's a bit of softness in that right knee. So never ever lock your knee joints or your elbow joints. And again, holding for 15 seconds. And relax. Job done. Do you want to do some triceps?
Had a few, if you've got time.
Yeah.
Just a few, just so she knows that she can do it at home.
So for your tricep extension, as always, feet are hip width apart and your knees are soft. You're going to take the elbow right up close to the ear and using a full range of motion or full range of movement, but weight comes all the way down to the shoulder and then you drive all the way up. Again, make sure you don't lock that elbow joint out, you keep a little bit of softness in through that joint, and if you just turn to face us forward, you can see the position of that elbow. So it's really facing forward, and that's what you need. Just turn your head to neutral because you're a little bit, that's it. So always face directly neutral. There's a temptation to kind of look around a little bit as well, but you need to keep that head in a nice neutral position. Deborah's actually quite good at these. And
15, all right?
yeah. And obviously the left arm on most people, especially those that are right-handed, the left arm's the weaker arm. So you're going to breathe in as you drop that weight down, and you're going to breathe out as you take the weight up towards the sky. Remembering soft knees, tight tummy, pelvic floor muscles pulled up.
If you're doing it right, you feel it right across there.
Yeah, it should be locked in solid, the tummy. And this is a good position. And you can see as she's getting tired, that elbow's coming out towards the side, so it's really important to pull that back. So,
What's the stretch?
yeah, so the stretch, if you turn round, Debbie,